Welcome back to Island Voices, where we dive deep into some really pressing issues facing our community. Today, we're discussing retirement, health, and financial struggles among the elderly here in St. Martin.
Absolutely. And it's a conversation that really matters, especially when you consider the increasing lifespan and rising costs of medical care.
Right, so to kick things off, we need to look at the retirement landscape here. In St. Martin, many folks are employed in tourism, hospitality, small business, or informal work. And because
Yeah,
these jobs usually lack formal pension systems or employer-based contributions, it leaves many older adults with only meager social benefits.
exactly. And that means when people hit retirement age, like 60 or 65, they often don't have a reliable nest egg. They rely on structures like the Social and Health Insurances SZV, which, while helpful, have their limitations in benefit levels and sustainability.
Right. And this limitation creates a ripple effect. With inadequate savings, many retirees' income only covers a fraction of what they earned during working years.
Yep, it's a real challenge. Speaking of challenges, when you lack enough savings, you're also exposed to inflation and rapidly rising living costs. Prices for food, utilities, and transportation can easily stretch a fixed income too thin.
Yeah, exactly. It's like, if you imagine your savings as a bucket and inflation as this unrelenting stream pouring in, before you know
Right,
it,
right.
the bucket just can't hold it. And add to that, many bear debt burdens like mortgages or personal loans that don't just disappear at retirement.
And on top of that, unexpected expenses can pop up, like home repairs or vehicle breakdowns, which further destabilize an already fragile financial situation.
Mm-hmm. And in a small island economy where investment opportunities are limited, many older residents find themselves relying solely on local banks or family transfers.
Indeed.
It's often not enough to compensate for years of hard work.
Now, shifting gears a bit, let's touch on the healthcare dimension. It's not just about money. Health is a major component of quality of life, right?
Absolutely. As people age, their medical needs increase. Chronic conditions, mobility issues, specialist visits, you name it.
Yep,
But
exactly.
if you're already financially strained, even basic healthcare can become a huge burden.
And while the SZV covers some basic and emergency services, long-term care services like nursing, home assistance, and rehab aren't fully sunk in by these benefits, which leaves many relying on expensive private caregivers or family support.
That's the kicker, isn't it? It's almost like you're forced into a catch-22. Without enough savings, accessing quality healthcare becomes a luxury rather than a right.
Yeah. And don't forget, for more specialized treatments, sometimes travel is necessary. Off-island trips to places like Curacao or the Netherlands can rack up costs in travel, accommodations, and even logistics, adding another layer of complexity.
It really paints a picture of vulnerability, doesn't it? Even a slight gap in healthcare coverage can push someone into serious financial strain.
Right, right. And it's not just about immediate health concerns. When preventive care is skipped due to cost or accessibility, it often results in more serious health issues down the line, which then amplify the problem.
You know, one might say that the system as it stands isn't really built to support the aging of our community. It's
Exactly.
like we're building our retirement plans on unstable ground.
Now, I get that some might argue that personal responsibility should play a role here. But honestly, it's tough when many start preparing too late due to irregular work or a lack of financial literacy.
I agree, though I do wonder if a bit more emphasis on community support could offset some of these issues.
Yeah, that's a good point.
But we must also acknowledge that structural changes are needed, not just individual efforts.
Absolutely. And that brings us to the broader social impact. When older adults are financially strained and under-supported health-wise, it affects not only their dignity, but also their social participation. They might be forced into substandard living, feel isolated, and even depend heavily on family members, adding strain to the overall community fabric.
Right. The stress of unpredictability and insecurity can really weigh them down. People might avoid social outings, which further isolates them, and that's a real shame.
Exactly. And when you consider that many are reluctant to ask for help because of pride or fear of being seen as a burden, the issue becomes even more hidden.
Exactly, it's like a silent crisis that detonates slowly over time.
Yeah, absolutely. Now, what about potential solutions? I understand there are some promising ideas on the table.
Yes, indeed. One major approach is strengthening pensions and social security. This means, reviewing benefit levels, ensuring sustainability, and importantly, closing the gaps that affect informal workers.
Right. And there's also a call to encourage personal retirement planning early on, boosting financial literacy, offering incentives like tax breaks, or matching contributions for private savings.
Exactly. It's about laying the groundwork before things get tight. And on the healthcare front, there's talk of expanding coverage to include long-term care, subsidizing chronic care, and even offering caregiver support.
Yeah, that's a constructive plan. Also, community care networks play a huge role here. Think senior centers, volunteer programs, and neighborhood health visits. That way, the elderly aren't left fighting this battle alone.
I completely agree. And there's potential for public-private partnerships to foster affordable, sustainable retirement and healthcare products tailored to the needs of our island residents.
Absolutely. While all these solutions sound promising, I do wonder if they're enough in a system where many still have to work past the point of their physical and mental health due to insufficient savings.
That's a fair critique. It's like solutions need to be not only multifaceted, but also swift in addressing the immediate vulnerabilities that our aging population faces.
Exactly right. It's a real balancing act, isn't it? On one hand, you have the need to overhaul systems for future stability, and on the other, immediate interventions to support those already struggling.
Yeah. And as we look to the future, ensuring that the elderly are seen not as burdens, but as respected community stakeholders is key. Their experience, their knowledge, their assets we need to care for.
Definitely. Well said. And I think that wraps up our in-depth look into the challenges and potential solutions facing St. Martin's aging population. It's a tough issue, but recognizing it is the first real step toward change.
Absolutely. Thanks for joining this discussion. It's been a deep dive, and hopefully it sparks further conversation and concrete policy moves to improve the future for all our seniors.